Umbilical Cord Care. Introduction. The umbilical cord stump will change in color from a yellowish-green to brown and then to black as it dries. Select true or false. Correct. After the stump dries out, it will fall off. How can you make sure your baby's umbilical cord stump stays clean and dry? Choose one of the following options. 1. Clean the stump and area around it with water when it gets sticky or dirty. 2. Keep your baby's diaper from covering the stump. 3. Use sponge baths until the stump falls off. 4. All of the above. Correct. Keeping the umbilical cord stump clean and dry is very important. This helps prevent infection and irritation. When does an umbilical granuloma require treatment by a healthcare provider? Choose one of the following options. 1. If it lasts longer than 2 days. 2. If it lasts longer than 5 days. 3. If it lasts longer than 1 week. Correct. An umbilical granuloma may require treatment if it lasts longer than 1 week. Jane's son Tom is 1 week old. Tom has a fever and there is pus coming from his umbilical cord stump. Tom also cries when Jane touches the area around the cord. Should Jane contact a healthcare provider? Select yes or no. Correct. Tom's symptoms can be a sign of a problem. Jane should contact her son's healthcare provider right away. Thank you for using Explain.